and we'll have the next panel discussion. So if I may invite our guests to come around and as we prepare for the next panel discussion, so there has been a need for physician wellness that has been very well recognized all across the world due to a spate of behavioral health, mental health crises that have occurred in the physician community over the last few years, especially since the pandemic started. And lots of questions have been asked about physician wellness. That's what prompted the next panel discussion about structurally what the hospital leadership can do in this regard. And if I may invite Shubham, please.
I would like to invite Dr. Srinivas sir, Director AIMS, to please come on the dais. Next we have Dr. Suresh Kumar, Director Lok Nayak Hospital, Maulana Azad Medical College. Next we have Dr. Shubhas Giri, Director Lady Harding Medical College, former Director UCMS and GTB Hospital. Next we have Dr. Ishwar Singh, Director and Principal Baba Saheb Ambedkar Medical College and Medical Director Indira Gandhi Hospital. And then we have two young dynamic RDA people, Dr. Rohan Krishnan, Chairman FIMA, and Dr. Vinay, President AIMS RDA. Next we have a very esteemed person who is also seems to be the chair of GHS, and he is he's from the mental health department in Mississippi Board, Dr. Sampath Shivangi sir. Next I would like to welcome Dr. Anupam Sibbal, Group Medical Director, Apollo Group of Hospitals.
At all the top hospitals of Delhi, all the top leadership of all the top hospitals of Delhi, all on one single stage. This is all a brilliant idea of Shubham and his team.
So we have seen, and even now everyone realizes how important mental health is. We have seen a huge spike of suicides and attempt to suicides among medical students, among residents, and among even the senior consultants. So why is this stress taking so much toll? And I don't think we can have a better panel of speakers to answer that. We have some of the biggest name of the fraternity sitting on the dais. And I would like to Dr. Sampath Shivangi sir to first give the opening remarks on physician wellness and how important it is.
Good evening, and thank you, Shubham. To say a few words about me, I'm from USA. I'm the chairman of the board of Mississippi State Board of Mental Health. I served 14 years. Even though my specialty is OBGYN, governor appointed me to make some changes in the mental health system in my state. And 5 years back, President Trump appointed me to the National Board of Mental Health at National Mental Health Center in Washington, D.C. So I had both state as well as National Mental Health Center. So I have some experience how to resolve mental health issues. It may be physician or youth or anybody who has issues with the mental health. Just to give you an example of fentanyl, which is the biggest menace in the US. 12 to 15,000 people in the US die every month because of one medication, fentanyl. So at the end of the year, it's almost 150,000 people, all they are educated, highly placed, people are die in the US. So that is our biggest problem. So when President Biden came into office, he sanctioned $12 billion to cut this menace of fentanyl or any drug abuse. Of course, we have I think India should learn some things what US is doing. It doesn't cost much. They have a new, I won't be too long, just for a minute or two. They have started the new department called 988. Those who are familiar with 911, which is the emergency call. What does 988 do? You call dial 988. There is a group of nurses, doctors, ambulance drivers, and other help. They will go to you wherever you are, bring back to the clinic, and that reduces 30 to 40% of admission into mental health institutions in America. I think this is a great lesson. I think this one, in January of this year, in Indore, there was a Pravasi Bharatiya Divas ceremony. Prime Minister was there, Modi ji, and Vandovia, Health Minister, was there. I offered them the solution. They asked me, well, how can we change Indian mental health system? I said, why don't you start the basic things like 988 in India? Of course, they asked me to come and explain. I did that. So that is in the books of Government of India. I think it will revolutionize the system of mental health. Maybe physician, maybe ordinary guy on the street, or highly placed, educated, billionaires, they go through the system. I think this is the one way. My feeling is, I think India should adopt this system.
Thank you for the opening remarks, sir. Now I would like Dr. Srinivas sir to give the opening remarks on this burning topic of physician wellness and mental health.
Thank you. You see, we have been in the All India Institute of Medical Sciences. You know that we manage one of the biggest medical institutions of the world with huge numbers. If you look into anything, whether it is the patients of 15,000 per day, with the people visiting is almost 50,000 per day, with the specialties around 52 plus, undergraduate courses, postgraduate courses, super specialty, fellowships, whole lot of things in a small place, and the stress of the things, because my teacher, Professor Bajpayee, is here. He always used to tell us, "Ek anar, sau bimar." There is 100 patients waiting outside, and there is only one bed inside the hospital. That gives a lot of stress and all that. But the thing is that most of the university hospitals and the universities, we see the suicides happening in the campuses and all that, and we have put many systems in place now which has cut down the things. And for the last 1 year, I don't think there has been any suicide in our institution. Vinay, am I right? Yeah. So it has not happened. So that we will share with you some of the things. Maybe people can have a look into the systems which we have put in there. And this is definitely an important problem because one, the idle mind is the devil's workshop. If the students don't go to the classes, they don't take part in the institution activities, academic activities, and if they are hooked into the mobiles and the drugs and the support systems not being there, so that's what it produces, and that's what we've cut down. We have made them more into the inclusiveness. They are taking part in all the things, whether it is patient care services, whether teaching learning services, research, even the research in the undergraduate level, not just in the postgraduate level. Stimulate them, simulate them, support them, and then we make them part of the system. That's what that is. And once they have that dynamism, vibrance, and the people around, moving around, doing anything, and adding up little bit of the things. Today you had a spiritual talk with the people. So that gives again a sort of support to the people. So all that adds up to the thing, the strength which the students get it. That's more important.
Thank you.
Now I have a question for Dr. Suresh sir. With rising trend of violence against doctors, what can be done effectively to combat this situation?
Good evening to all of you. It's a privilege and great to be part of esteemed panel. I represent the oldest medical college of the town, the Maulana Azad Medical College. 90 years back, hospital was established, and MEMC is the great teaching hospital, and every year we have lot of stress. During COVID pandemic, we lost 13 doctors and nurses, highest in the city. If we see the doctors and nurses casualties during the pandemic, we have seen that the mental health is a great challenge for all of us, and the physician burnout is very common in our tertiary care hospitals. And if you see that it's basically a syndrome, occupational hazard, and most of these PG students, the DM MCS students, which we have, they have some personality issues, emotional issues, and they have some eating disorders. And we have, they are sleep deprived, and we have seen that they have long duty hours and they are irritated. So sometimes we have a large number of casualty visits, around 1,000 people visits our emergency department daily. And if any doctor is there who is sleep deprived and somebody is misbehaving in the casualty or in the ward, the violent situations are very common nowadays, because patients are very impatient, they are poorly informed, and they want attention. So most of the situation is because of some communication gap, because nowadays most of the doctors are talking in the casualty on the phone, and the patient attendant say कि doctor तो बात कर रहा था phone पर, मेरे patient को नहीं देख रहा था, and they immediately assault the doctor. So this happens, we have seen many times it happens, because this problem of assault on the doctors is multifactorial. It is not the one way. Not only the physicians are responsible for that, but public at large, poor quality of healthcare delivery system. And I was just going through the Secretary General's remark that we are leader in global pharmacy, we are leader in IT, we are leader in vaccine production. But somehow the quality cares, and we see the doctor-patients ratio, which is very high in the urban areas, metro cities, but it's very poor in the rural areas. So a lot of migrant patients are there, and they are not timely attended. So this situation of aggression is there, and the respect for the medical fraternity is decreasing because of multiple reasons. So these are all important factors, and the mental health particularly of the resident doctors, the junior doctors, are very, very important, and it is a great concern. Thank you.
My next question is to Dr. Ishwar sir. How can physicians effectively manage stress and burnout to maintain good mental health?
So the burnout is because of the overworking, and it is the hostility against doctors occurs because there is a lack of communication. So it is the patient factors as well as the doctors factors. The doctors, they need soft skills, and in that it is the communication. Patient should be informed what is the status of the patient. Yesterday itself, when I was in Baba Saheb Ambedkar, the attendant came, because the patient was not told what is the status of the patient since morning. Because the husband was told, now the other attendant, he also wants to know what is the status. So it is the communication, and the patients, they have high expectation, because patient has come from far off, and it is only the metro cities where the facilities are there. So it is the question of demand and supply, or the availability. So that leads to hostility, and patients have high expectations, and the doctors doesn't have time, and they lack the communication, because that communication or the soft skills, how to behave, aptitude, all that thing is missing, and there is a mismatch between that, and that leads to the hostility.
Thank you, sir. That was a really important thing that you mentioned. Next question is to Dr. Giri sir. Sir, we as physicians often neglect our own health. What can be done by the institutions to combat this issue?
Thank you to the organizers to call me and giving me the opportunity to speak. I'm in the habit of saying few words. See, when we talk about the life when it starts during the residency for a doctor, because recently in the papers also it has come, there is stress among the doctors and the physical health of the doctors and mental health is getting deteriorated. A doctor who is sitting in the OPD in India because of the population rush, because of the gap in the healthcare, because of the accumulation of the money at the higher level, and many poor people are left out without the care, and when they come to the hospital, their expectations to with the bigger institutes, where, like medical college, like I'm working with I'm managing Lady Harding Medical College. It is the oldest women college of the India, which started in 1916, and we have completed more than 100 years. At present, we produce roughly 240 students every year for MBBS courses, and other courses also we run the undergraduate courses. 175 MD and MS courses, DM and MCH courses also. Roughly we have 1500 bedded hospital over here. One is a Sucheta Kriplani hospital, then Kalavati Saran hospital. But I personally feel when I started my life in a postgraduate institute in Haryana, you used to have very lesser number of patients. Now what I said, because of the gap of the healthcare, because of the increasing population, the number of input in the government setup has gone increased hugely. A resident doctor who is sitting in the OPD is surrounded by at least 10 patients. He starts his OPD roughly at 8 o'clock. He is about to finish his OPD at 2 o'clock. He becomes totally exhausted. Number of patients are not limited. And he goes back to his lunch. He had lunch, then run off to the ward, get ready for the round, get a pressure from his senior resident and then from the faculty also that some of the works are pending. He finishes up his work at around 7 or 8 o'clock in the evening, go back to the hostel if he is not on emergency duty. Sleep off in the morning again. In the night he studies something, does his research work, and then again back on his track. You see, I'm taking up one picture of the resident doctor only. Now where is his personal life for exercise? Where is the time for his things for recreationals? And what we are doing or what we are expecting out of him? A resident doctor, whatever number of patients are coming to the OPD, he has to see whether his OPD finishes at 4 o'clock or more than that. Then going back to the ward, he has to see all the patients, whatever has been admitted under him. In the emergency, it is not one patient, it is not two. If it is 100 patient, he has to see that also. So where are we? What is the root cause? Why we are not able to maintain a good health? Why we are getting the illnesses? Why are we getting the stress? So to me, I personally feel the root cause is, one is a population. The increase in population in our country is basically we are getting lot of stress on the resources, and slowly our resources will get depleted. And somehow, as a physician, when we talk about our own health, we don't have any time for that. Most of the time you find, you see a patient, write certain tests, you examine the patient, give them the prescription. That patient follows you. But are you following the same? No, we are not. Say, I'll give one example. A doctor who drinks daily, he will always say, don't drink. A doctor who occasionally smokes, even to the patient, he will say, don't smoke, but he will not halt his own habits. Now, what I personally feel, that it is not only the time, it is not only the stress, it is not only the workload. The many factor has come up together where our health is getting suffered. The workload, it is our policies, it is the expectations of the people who are getting educated, the vigilance, awareness, pressure from the administration, process from the bureaucracy, court cases, litigations. Everything is coming together and making a doctor more sick. He is getting burnout, he's getting fatigued, and then you see he get depressed and other mental disorders, and finally sometimes we lose the life also. And the life of a person like the one who was pulling a train which was having a mammoth number of passengers in that. So that is what I personally feel. We have everyone, not only the physician, not only caring for their own health, for the public also, for the government also, for the planner also. We should send the message that it is not a one-point policy. You have to intervene at multiple level. Then only we can think of a better health for a doctor. Thank you very much.
You raised very valid point, sir. My next question is to Dr. Sibal, sir. Sir, nowadays we are seeing that even in the private sector, private hospitals, the patients are being more aggressive. And also the second question is, in private sector, we see more of Google doctors nowadays. So how as a doctor we should tackle that? The Google patient, sorry.
Thank you very much. One of the things that I think we need to address is this, and I had hoped that COVID had done that for us, is breaking away these silos that we function in, public, private. At the end of the day, it's about delivering healthcare, and for a patient, it doesn't matter, whether he's seen in a public hospital or a private hospital, because some of the problems that we have really cover both sectors. And I think it stems with this whole concept that we have, is that the patients really have unrealistic expectations. In the public sector, they want things done faster. When they see the queues, they get agitated, they get upset when they are told that there is no time for an MRI happening the next day and you have to wait for surgery. It leads to a sense of I've been let down. When we look at it in the private sector, the expectations are very unreal, in that they expect that the physician is going to be available 24/7, is going to answer every single query that they have on WhatsApp. And I think life was so much easier when we didn't have cell phones. And I think what WhatsApp has done to our mental health is huge in terms of the downside it has. Now, I'm a pediatrician and a pediatric gastroenterologist, and I'm quite often asked, can we see you on Sunday afternoon? And I say, why? But that's our holiday, so a doctor is not supposed to have any time off. If you have a regular patient and the patient chooses to send you a message at 10 p.m. and you decide to respond the next morning at 7 a.m., you'll say, but we sent you a message at 10 p.m. So what is happening is that these unrealistic expectations that have been built into the system over a period of time are becoming very, very difficult and very, very stressful. Now, also, I think we have our generation to blame in many ways for making life pretty miserable for people like Rohan and the young physicians, because we never tire of saying in our rounds, but when I was doing my post-graduation, we started our on-call in the morning and we used to go back the next evening. Anyone here who's not said that to their trainees? With a great sense of pride. And the more patients you see, the better you'll get, and the harder you work, you'll get better. We forget that the present generation, and I'm so happy that they have a concept of a work-life balance, which senior physicians do not have. And they actually question, why should I be in hospital when my work is done? Why should I hang around for an extra length of time? It's a very legitimate question, and I think we need to respect that and be cognizant of the fact that there is actually nothing wrong in actually having a work-life balance. And this whole rut that we are into in terms of competition. Now, in the private sector, there's huge amounts of competition. And the reason for that competition is that, fine, we might be producing 1,07,831 MBBS doctors for a country the size of 1.4 billion. That is does not mean that there's going to be too much. There's going to be difficulty for a doctor in finding work. The problem is that everybody wants to work only in certain cities. They don't want to go outside. When I started practice, there were 800 pediatricians. Today there are 5,500 pediatricians. How are they going to manage to be able to sustain themselves if they are in the private sector? So that also leads to an added pressure. And the public sector, I think there's a different kind of pressure. There's a resource crunch, and I'm not talking about All India Institute. Dr. Srinivas is privileged that you have a handsome budget from Nirvan Bhavan, but that is not the case for many other government institutions. So there's a lot of pressure on the doctors who have to face this stress from patients who believe that they're not getting the treatment that they deserve. So I think it's quite complex, the problem that we have, and I think it needs to be addressed at multiple levels. But just one comment on mental health. I think conventionally in India, people are very hesitant to seek help. It's like this whole thing about, oh my God, I'm going to see a psychiatrist or I'm going to see a counselor, and that also applies to the medical community. And I think we need to have an open culture where whether it's senior doctors or junior doctors can say, listen, I'm feeling a bit down, I need to talk to someone. And when at GAPIO we were looking at addressing some of the challenges during COVID, the most popular 5 sessions we had, and we had an audience from 50 countries plus of physicians of Indian origin, was a session with Sri Sri, the session with Sadhguru, the session with Sister Shivani, and I think I don't know how many 100,000 people we had when His Holiness the Dalai Lama addressed us, because everybody had that craving. They wanted someone to guide them on how to be more at peace, and that is something that we need to encourage. One final thing that I want to highlight is that what can we do as institution leaders to encourage well-being? Well, at Apollo, we decided, and Dr. Reddy, our chairman, decided about 3 years ago that unless everybody had their medical, they would not get their salary. So no employee at Apollo till 31st of December, you have to get your annual medical there. Otherwise, you don't get your January salary. And that also applies to consultants who don't have a salary but get paid. So this really helped us get, quickly it went up to 100% because we were saying, no, you should. It didn't really work. The moment we passed this, we've now got 100% compliance in terms of getting an annual medical check. So that's something that other institutions might want to look at. Thank you.
Thank you, Anupam. That was a brilliant overview of how we went. Well, we in the US, in New York, in my institution during COVID and all, we did go through quite a lot of challenges. And that structurally, the leadership, I was in the leadership position at my hospitals, and we quickly came up with some. It was like we were shooting from the hip at that time. Everybody was. So we came up with solutions very quickly. And one of the most brilliant solutions was this peer review, peer-to-peer contact. We set up a toll-free number where anybody who's feeling overwhelmed could call, and a peer would pick up the phone anonymously and answer the questions of how to build up. It's all about building up resilience. I get medical students ask me all the time, and we could just to continue this whole discussion, I'm going to invite Dr. Chanchal Pal, the senior ENT specialist consultant at Apollo Hospital, to continue with the program.
Thank you, Dr. Indrapal. Very good points raised by each one of you, and thank you for coming. And when we decided, me and Shivam decided to have Directors Forum, this was the topic which we wanted to have, especially for junior doctors. So we have 2 RDA presidents also. They are the one who we have all faced when we were residents and junior doctors. We faced what everybody is going through, and times have not changed. We have progressed, science has changed, things have come, robots have come, AI have come. But the problem of the junior doctors, resident doctor, their duty hours, their conditions not much changed. So I request our resident doctors to let it come directly from you. What is the problem? And we have all the senior members who are policy makers also and actually in contact with government directly. So can you raise the problem before I ask few pertinent questions myself? Thank you.
Thank you, ma'am. First of all, I'd like to thank the team of API and GAPIO and GAMES and AIMS New Delhi for having this session. I would like to tell all of you that there is no clear-cut data about the suicides being conducted by Indian doctors in the country. Indian Association of Psychiatry created a group and they started to collect data. And they collected that between 2018 to 2020, 30 doctors had committed suicide. And this data was collected, sir, from the newspaper clippings. None of the associations or the government has yet proven anything for that. Then out of that 30 suicides which has happened, 80% of the suicides were among those who were below the age of 40 years, and 60% of the suicides were among the postgraduate residents. So this is the tip of the iceberg that we are talking about. Can you imagine the mental torture a person goes through before committing suicide? It is the end step. Before that, you will have to go through a phase of depression, anxiety, what to do, what my family might think of, and numerous other problems. But when we want to speak about our problems, I think that Sir rightly said that all the HODs and unit chiefs and all the senior faculties, they'll always say कि यार मैंने तो करा था तुम्हें पता नहीं क्या दिक्कत हो गई है करने में. We used to do like this, we used to be like that. I want to raise this issue to all the senior people that suppose if you have done your post-graduation in the year 2000, the population of that country, of our country, was 105.96 crores at that time. And today the population is more than 143 crores. So we are dealing with a hell lot of patients which was not there at that point of time. With increase in a lot of investigations, in a lot of treatment modalities, AI is coming up, robotics is coming up, intervention radiology, chemotherapy, neoadjuvant therapy. If I pick up any subject, the era of super specialization has set in, and there is day to day a number of increase which is happening in the medical treatment facility. It has its very much positive effects. The life expectancy has gone up because of that. But on the other hand, the doctors which we are producing, the working hours is increasing. The Delhi High Court, we had filed a case in Delhi High Court about to specialize about the working hours of the doctor. It has advised that it should not be more than 48 hours a week for resident doctors, and not more than 12 hours of duty should be continuous duty. But in all the medical colleges of the country, except few of the medical colleges where the directors are very active and they hear to us, in 90% of the medical colleges of the country, this is happening on paper only. So they are doing 36 hours duty continuous, 72 hours to 84 hours duty for a postgraduate resident is very common. For a senior resident, it is very common. And if they want to raise their voice against this, I have a lot of more than 25,000 messages in my Twitter account in which they are saying that these are my problems and I don't know how to speak to them. And when they raise their voice, they are throttled like anything. They are being told not to come to OT. They have been told that they have been marked as mischievous people. They have been told that you will not pass in your DNB and PG examination. So in what era are we living? We have to decide that. All these big policymakers are here. One big problem which we are facing for the resident doctors is the bond policy. Every state in India has different kind of bond policy. When I was working in UK, I just asked few of my friends that what is the dropout rate of students here, those who have taken admission and those who don't want to continue their course any further. They said that it is around 50%. And in India, a student of Kerala has messaged me today itself that he is doing DNB surgery and he wants to leave his course. He does not want to continue his course. Then his fees, that is fine, and the penalty is 50 lakhs of rupees. So this creates a lot of havoc to the students if they want to do something. Firstly, one must understand that if we want to pursue postgraduate education and get our dream subject, we work really hard for that. And if someone wants to leave it, just understand the mental level of problems that is going through and he wants to get away with it, then I think that it is on humanitarian ground. He or she has all the rights to leave the subject if he does not want to continue. This policy of the government that you cannot leave a subject after taking your post-graduation. This bond policy that you have to continue work, why is it not being followed in IIT? Why is not followed in IM? I have government data with me, which is saying that out of 10,000 seats of IIT, 20% of the population leaves the course before completing the course. So if these things are there in IIT and overall in the technical education, in postgraduate and supergraduate education, if we see that more than 25 to 30% dropouts are there in all the other courses in the country, except in the field of medicine, because here we are doing bandhua mazduri, here we are doing something which is synonym of slavery, because you are not allowing a person to leave the course. The government sector will say कि हमें पेनल्टी बॉन्ड पेनल्टी दो, द प्राइवेट सेक्टर विल से कि हमारा फीस कौन भरेगा, हमारे बच्चों का क्या होगा, उन बच्चों का क्या होगा जो अपने ड्रीम को छोड़ना चाहते हैं, उसका कोई नहीं सोचता है, गवर्नमेंट नहीं सोचती है, स्टूडेंट्स नहीं सोचते हैं, डायरेक्टर्स नहीं सोचते हैं. इस पे सर आप लोगों को बिल्कुल करना चाहिए. और प्राइवेट प्लेयर्स को भी वी मस्ट गिव अ मैसेज कि इफ़ वी आर लिविंग समथिंग विच वी लव, if we are leaving something for which we have worked so hard, I think that we have all the rights to leave a subject and then choose our dream subject.
Point well taken.
नशा दौलत का ऐसा भी क्या कि तुझे कुछ और याद नहीं. So we have to think that also in that matter. And I think Vinay must also cover.
If Vinay have any other point, the point well raised. I have actually stirred the bee's nest.
Good evening, everyone. So my name is Vinay, and I'm SR, Anesthesia and Critical Care at AIIMS. And currently, I'm the Resident Doctor Association President of AIIMS. So एक चीज़ है कि मेंटल हेल्थ की अगर हम बात कर रहे हैं, एंड रोहन हैज़ कवर्ड अ लॉट, तो एक चीज़ है कि क्या हमने कभी किसी की मानसिकता, किसी रेजिडेंट डॉक्टर की या MBBS बच्चे की मानसिकता सोची है कि वो यहाँ तक किस स्ट्रगल से आया और कैसे यहाँ पहुँचा? मैं हिंदी में इसलिए बात कर रहा हूँ क्योंकि ये भी एक मेंटल स्ट्रेस का कारण है.
But we have all gone through that, all of them who are sitting here.
Exactly. मैं हिंदी में इसलिए बात कर रहा हूँ
होता है, सास कहती है कि मैंने सहा तो तुम क्यों नहीं सहोगे?
Exactly. मैं
I'm sorry, I'm with them.
No. मैं एम्स में काम कर रहा हूँ, एंड एम्स एक छोटा सा देश है, इंडिया को रिप्रेजेंट करता है. हर रीजन, हर स्टेट से लोग आते हैं. जब मैं अपने स्टेट यूपी से आया तो मुझे लगा कि यार यहाँ सब लोग इंग्लिश में बात कर रहे हैं. फिर मैं 2-4 बिहार के, यूपी के, हिमाचल के लोगों से मिला और उनके अंदर एक कुंठा थी कि मैं इंग्लिश में बात नहीं कर पा रहा हूँ, मैं कैसे कम्युनिकेट करूँगा. ये जो लेवल है, यहीं से डिप्रेशन चालू होता है, क्योंकि पहले वो एंग्जाइटी में आएगा कि मुझे कैसे कम्युनिकेट करना है. मैं जब स्टेज पर आऊँगा तो मुझे लगेगा मैं इंग्लिश में बात नहीं कर पा रहा, अब मेरा मेंटल लेवल क्या है, लोग मेरे बारे में क्या सोचेंगे. एग्जैक्टली यही सिचुएशन होती है मेडिकल कॉलेजेस में. और फिर वो धीरे धीरे सेपरेट आउट होने लगता है, लोगों से बात नहीं करता है. और बात ना करना सबसे बड़ा कारण है मेंटल इलनेस का. तो इसलिए ये जो अवेयरनेस का प्रोग्राम हो रहा है या कोई समिट हो रही है, ये होती रहनी चाहिए, क्योंकि जब तक अवेयरनेस नहीं होगी, हम क्या करते हैं, हम एज अ रेजिडेंट हम अब सहते रहते हैं और धीरे धीरे एंग्जाइटी, फ्रस्ट्रेशन, डिप्रेशन एंड सुसाइड. ये सुसाइड होना ये लास्ट स्टेज है, रोहन ने बताया. क्या ऐसा करें, क्या ऐसा चीज़ पॉलिसी, क्योंकि सभी यहाँ डायरेक्टर्स हैं और सब, जैसा आपने कहा कि सब अपने अपने टाइम पे बहुत ये सब स्ट्रगल करके आए, बट क्यों ऐसा अभी भी क्यों हो रहा है?
Let's conclude and ask them what all can be done.
एज अ ऑल इंडिया इंस्टीट्यूट, मैं वहाँ का प्रेसिडेंट होने के नाते गवर्नमेंट पॉलिसी मेकर्स के साथ साथ खुद जिम्मेदारी ली है हमने एसोसिएशन की तरफ से. और जो ऑनरेबल सुप्रीम कोर्ट का ऑर्डर है, रोहन ने मेंशन किया 48 आवर्स अ वीक, 8 आवर्स, उसको इम्प्लीमेंट करने का हमारे डायरेक्टर सर ने बहुत अच्छा एक सिस्टम निकाला है कि हम एज अ रेजिडेंट फैकल्टी सब फिंगरप्रिंट एंड फेशियल रिकग्निशन करेंगे, जिससे हमारा एक डेटा कलेक्ट होगा जो गवर्नमेंट के पास जाएगा. क्योंकि बोलते तो सब हैं, डेटा कहाँ है कि हम एक्स्ट्रा काम करते हैं. हम रेजिडेंट डॉक्टर एसोसिएशन होने के नाते अपने रेजिडेंट्स के लिए बहुत सारी रिक्रिएशनल एक्टिविटीज़ कराते हैं, स्पोर्ट्स एक्टिविटीज़ कराते हैं, योगा एंड मेडिटेशन सेंटर कराते हैं, स्पिरिचुअल टॉक्स हमारे यहाँ रेगुलरली हो रही हैं. आज आपके ही कॉन्फ्रेंस में हुई एक. ये सारी एक्टिविटी और स्पोर्ट्स एक्टिविटी मैं बता रहा हूँ कि पहली बार हमने इस बार डॉकलिम्पस टाइप का एक ऐसा इनिशिएटिव किया कि इंडोर, जो लोग आउटडोर नहीं कर सकते इंडोर, अभी हमने एक हफ्ते पूरा क्रिकेट का एक टूर्नामेंट कराया। तो धीरे धीरे जब रिक्रिएशनल एक्टिविटीज़ होंगी, स्ट्रेस लेवल अपने आप कम होगा। सब्सटेंस अब्यूज़ जो इस वजह से हो रहा है वो अपने आप कम होगा जब आप अपने को प्यार करेंगे, सेल्फ केयर स्ट्रेटजीज अपनाएंगे, क्योंकि अपने आप को प्यार करना भी एक बहुत अच्छा तरीका है मेंटल स्ट्रेस से बचने का। और इंस्टीट्यूशनल सपोर्ट, क्योंकि यहाँ जितने भी हैं सब स्टीम लर्नेड डायरेक्टर्स, पॉलिसी मेकर्स हैं। इंस्टीट्यूशनल सपोर्ट में ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंस में इस समय फूड वेंडिंग मशीन हमारे डायरेक्टर का इनिशिएटिव है कि हेल्दी फूड होना चाहिए। मिलेट्स, स्प्राउट, पोहा और ऑटोमेटिक वेंडिंग मशीन हर ओटी वार्ड के सामने। नॉट ओनली डॉक्टर्स, हेल्थ केयर वर्कर्स, पेशेंट और उनके अटेंडेंट्स के लिए भी ये सुविधा हमने कराई है। साथ साथ में हर एक आईसीयू के सामने हमारा इनिशिएटिव रहा है कि हम हर एक ग्रुप को रिप्रेजेंटेशन के लिए, जैसे कोई हिंदू मानता है, कोई सिख मानता है, उसका एक ऐसा जगह बने जहाँ वो प्रार्थना कर सके और उनके रहने का उचित व्यवस्था हो। तो धीरे धीरे जब हेल्दी फूड हैबिट्स आएंगी, हेल्दी लिविंग कंडीशंस होंगी, अपने आप मुझे लगता है मेंटल स्ट्रेस बहुत अच्छा होगा और एक बेटर इंडिया हम डेवलप कर पाएंगे।
Thank you. Point well taken. You have raised the problem and given the solution. Before I conclude, I'll just like to say that two places, especially aims which you have done, which Rohan was telling, that so much has been done for mental health. Apollo, I myself experiencing what Dr. Anupam Sibbal has said, that it is compulsory for us to have annual health checkup. Reminders come to us. The vaccination is also compulsory, and the food also, and there is enough recreation, and we have even gym there. How many of us use, that's a different thing, but we have all the facility. I think all the hospitals can do that. But main point which come out, that number one, the duty hours should be limited as per labor law. Wherever possible, all the directors, they should talk to the government. That is with our directors, few of the directors also raised this question. Type of the living condition. Have you ever seen their duty rooms? As a seniors, we should go to their duty room and see which condition they are living. Are they comfortable whenever they get time to sleep? So all these conditions have to be looked after. And in emergency, ICU and OT, in my opinion, you should have proper security. There should be no crowding in OPD around there should be enough waiting area. When I joined one of the private hospitals where there used to be a lot of general OPD, like in Mulchan Hospital, we used to have 30 to 40 patients. When I was very junior as a consultant, I asked them to get a fan in the corridor. I'll only allow one patient to come to me so that I can listen. It's not good that 50 patients are around you. You can't treat them properly. So something can be done. So as a directors, whatever, I know you also have limitation, but all of us have gone through. Why should we allow our juniors to go through that? अगर हम अपने बच्चों का ध्यान नहीं रखेंगे तो कोई भी नहीं रखेगा। ये हमारे बच्चे हैं, इनका ध्यान हमारे को रखना और हमारी कंडीशन का भी रखना। हम भी बहुत, आज स्वामी जी ने जैसा बताया कि हमको अपनी टाइम लिमिट रखनी है, अपनी टाइम मैनेजमेंट करना है, अपनी हेल्थ पे ध्यान देना है। सो विद दैट आई थिंक आई लाइक टू कंक्लूड फ्रॉम माय साइड. अदर थिंग विथ undergraduate education, you should teach them soft skill. If you feel that there is communication gap, that lecture should be there. But when the patient get aggressive, I have seen my resident doctors being surrounded by aggressive crowd. That should not be allowed. Even in hotels you have boxers, in your clubs you have boxers, but when it comes to your hospital, when patients are getting aggressive, in our own hospital हम कोई पीट के लोग चले जाते हैं, हम देखते रह जाते हैं. So I think that these three key area, you should have enough security that rowdy crowd doesn't come. Soft skills should be definitely taught, and there should be a proper psychologist always around the corner with a number given to the students, that in case of emergency you talk to them, and there should be a confidential talk, that the conversation will not go to the person concerned or department concerned, so that child can be very freely can talk about it. That is my input. I would like any one of you want to give any input before we conclude and start some maybe entertainment for ourselves.
Chanchal, I want to make a point.
Sure.
I am from Sevagram, that is Mahatma Gandhi Institute of Medical Sciences, and there we used to hold all religion this thing meet, and that used to be on Friday. There used to be prayer, and our director, late Sushila Nayyar, she used to chair that session. And before that, we used to have a shramdan in which the dignity of labor used to be there, and we used to clean the field or the premises ourselves, and it used to be everybody. So it used to be kind of community kind of work, and where Sevagram is totally boarding college, means there is no day scholar. Even the wards or the faculty, they used to come and stay with us in the hostel. So that was one. So we have a strong bonding. And you know, KK Agarwal, late KK Agarwal, he was my senior, and I still remember he used to go to the hostel only to change or to take a bath. Otherwise, whole day he used to be in the ward. That is the mental makeup he had. The prayers and the community get together kind of thing used to be there, and the students are allotted this villages family, and we used to have a village visit every fourth Saturday, and that used to be kind of picnic. We used to go in a bus and all singing and that.
So was or it is still continuing, sir?
It is still there.
Good. Yeah.
So that used to be making the gel whole of the batch together, and that thing is still continuing.
So we can take advice from there, please, sir.
We have recently taken one project from ICMR where we can motivate our young PG students and young doctors that they can assemble during lunchtime, and we have the musical fountain and other recreation activity there, and that project is just we have started. That to decrease the stress among doctors, they must meet, they must have at least 2 or 3 minutes compulsory get together and laugh. They have a deep breathing exercises, and they can even do the yoga and meditation, and that really worked very well. So this project we are now doing in MAMC.
But we can do something for duty hours also, sir. We have seen children doing duty hours of 24 hours. I think that is there only in medical science and police. Both the places very difficult for us.
More than 24 hours.
Yeah.
Say
So I think now you're in that position.
I was in LNJP for 27 years. The resident would do 24 hours, one day emergency, next day he would be in the OT, and the evening OT would run till 6 o'clock in the evening, and next day he will be there for the round. So that is the routine which is happening. That is the practically which we have seen.
Thank you. I liked Shubham to give thanks to everybody, and I think Dr. Indrapal can do felicitation.
I request our National Dynamic President of API, Dr. Anjana Samadar, to kindly come on the stage to felicitate our esteemed panel. I request Dr. Anjana Samadar to kindly hand over the memento to Dr. Srinivas Sir, Director, AIMS Delhi.
You can come here. Thank you so much. You can come.
Helping hand.
Next, I request Anjana ma'am to kindly give memento to Dr. Suresh Sir, Director, LNJP.
Very nice program. Very effective and useful for students. Great program. Thank you very much.
We have a very respected person among us, Air Marshal Dr. Sadhna Nair. I request ma'am to kindly come on the stage and hand over memento to Dr. Ishwar Sir. I request Dr. Sadhna ma'am to kindly give the memento to Dr. Subhas Giri Sir, Director, Lady Harding Medical College and former Director, GTB Hospital. We have with us our Chairman Board of Trustees, RP, Dr. Lokesh Idara. I request sir to kindly give memento to Dr. Rohan Krishnan. And we are also fortunate to have on the dais Dr. Sampath Shivangi sir. I request him to hand memento to Dr. Vinay. I request our Secretary RP Dr. Sumal Rawal to kindly give memento to Dr. Anupam Sibbal sir, Director Apollo Group of Hospitals. We also have 2-3 special awards. So we have a young entrepreneur amongst us, Mr. Surpreet Singh from Psychocare. I request Director AIMS Srinivas sir to kindly give the memento to him. Surpreet ji, you want to say something?
Concluding remarks.
You can say 1-2 lines for sure.
Yeah, we want your concluding remarks.
Thanks a lot for this. It means a lot. As you mentioned, young. So I started young, but I think I've crossed another like 35, 36. So, but yes, it has been so inspiring being here. I also host a podcast. The theme is Inspire Me. Today I'm inspired like umpteenth number of times. It's an honor again, and thanks a lot. It motivates me to do more things and learned a lot what needs to be done. As an entrepreneur, we have a social responsibility as well. So we'll work on that. Thank you so much. Thanks.
We have one more category of award, that is significant contribution in healthcare, and it goes to Saurav Kasera from Clarnet. I request Srinivas sir to kindly give him the memento.
Sir, I will never think of it.
Especially to do with the bulldogs.
IT being make the doctors redundant. You can't do that.
And it would be an honor for me to present the award of the day, Lifetime Achievement Award. I request, we have an esteemed panel, if we can just come together and hand that award to Dr. Abhijat Seth sir, President, National Board of Examination. I request if all directors can come forward. I request President RP Dr. Anjana Samadar and BOT Chair Dr. Lokesh Idara to kindly come on the dais.
You want to read this?
Read this, sir.
You want to? No, come, madam, you come first.
all of us.
No, of course. You want to read?
Hi, hello, namaste. Yeah, go ahead, you put it.
Go ahead.
Up put it.
You want to read out?
You go ahead.
So what?
Read it out.
So this award is presented to sir in appreciation and recognition to the distinguished leadership in the medical education field. I request all respected directors to kindly join in this celebration of achievement of the lifetime.
You want to say a few words? And also,
Very good evening and namaste to all of you. I must extend my gratitude to API, particularly the leaders of API, Dr. Anjana, Dr. Lokesh and many of them, Dr. Sumul, and also I have visited many of them during my previous conclave. I also extend my gratitude to my organization, National Board of Examination of Medical Science, and Ministry of Health and Government of India, because this particular assignment I am running for last 8 years. This is my second term, and without support of these organizations and also the key players, key stakeholders like Niti Aayog, all of them, and NMC, this couldn't have been possible to progress from where we were in 2016. I also extend my gratitude to my parent organization, Apollo Hospitals International Limited, Dr. Pratap C. Reddy, and Cadila Pharma, of which I am an independent director, Dr. Rajiv Modi, because with their guidance and their mentorship and their help, I could advance to this stage. Here, my dear friend, Dr. And colleague, senior colleague, Dr. Anupam Sibal is there. Many of the Apollo chiefs has always helped me. Very interestingly, I used to contribute a lot of time while my parent organization was Apollo Hospitals. And one of my promoter, Dr. Sangeeta Reddy, told people that we have given him for the national services. And we are not worried how much time he spends in the Delhi. So thank you to all of you. And thank you very much.
and sorry, stay. And we wanted to ask Dr. Minu Bajpai, Executive Director of NBME, and Dr. Rakesh Sharma, member of NBME. So you want to recognize the award, you can read about it.
So next categories of awards is for the Outstanding Leadership Award. So it goes to Dr. Minu Bajpai sir for in appreciation and recognition to his distinguished leadership in promoting medical education in India, and also his role as Dean of All India Institute of Medical Sciences. I request President API and BOT Chair API to kindly hand over the award.
Thank you. So nice. Next one. No, go ahead. Go ahead.
Then again, Outstanding Leadership Award goes to Rakesh Sharma sir for his extensive work that he has done in promoting CPR throughout not only just India but throughout the world. I request Sampath Shivangi sir to also join in honoring Rakesh Sharma sir.
We'll do that later. We have one more. Okay. Okay.
Thank you very much profusely, and thank Dr. Idara, Dr. Samadar, the entire organizing committee and the leadership of API. It has been a great pleasure being associated with them for the last 3 years, and that happened when I joined as an honorary executive director of the National Board of Examination in Medical Sciences and its vice president. And I heard all what has happened this morning, and also in the afternoon we participated in our very valuable panel discussion. Similarly, this evening also, the topics which have been discussed are really very relevant today. And the intent and the intensity both is very contagious. I can only say that API is going strides, and but in times to come, I think the gathering will become even larger, although they have a global presence now. And with these words, I would like to thank them once again and wish them all the best in the journey. Thank you so much.
just say. I'll say.
I request our National President Api to kindly honor Dr. Sibal with a shawl. I request ma'am to say something first.
I just wanted to announce that we all unanimously agreed that Dr. Anupam Sibal, who's also our GHS chair in Delhi, the Distinguished Physician Award on behalf of API. Can you please say a few words, Dr. Sibal?
Dr. Anjana Samadar, Dr. Lukesh, the leadership of API, all the distinguished leaders from the United States representing API and the leaders here. We are here this evening really to celebrate the amazing contribution of physicians of Indian origin in the United States in clinical care, in academics and research. The fact that every 7th patient in the US is seen by a physician of Indian origin is really a testament to the stature that the Indian physician, the Indian diaspora has in the United States. And we often talk about your success and the fact that you've kept the Indian flag high. So I think let's put our hands together for API and for the amazing work they do. I mean, this is about honoring API, so I really don't deserve this particular award, but thank you so much for this award. And of course, we are here today, all of us physicians of Indian origin, united by our heritage, our culture, our history, our ethos, and of course, our love for our country. And quite often we say we are so proud of being an Indian. And actually, there is a video that Anjana wanted me to play. If we could have the audio visual on Proud to be an Indian.
Small announcement.
Yeah.
I would like to invite API offices, the Vice President, Dr. Amit Chakravarti, and also API Treasurer, Dr. Ganga Sani, and the Board of Trustee, Dr. Malti Mehta, to come up on stage, please.
We often say, I'm so proud to be an Indian. What is it that we can be so proud of? A lot, actually. In our glorious history of 10,000 years, we have never invaded any country. Mahatma Gandhi gave the world the message, an eye for an eye only ends up making the whole world blind. We are the world's largest democracy. In the 2019 general elections, 603 million Indians voted, which is more than the combined population of 5 of the G7 countries. What can be a bigger testament to the vibrancy of our democracy that for one voter, Mr. Darshan Das of Banej village deep in the Gir forest, the Election Commission has been setting up a polling station since 2004, as no Indian should have to travel more than 2 kilometers to cast her or his vote. We are a secular country with 1.42 billion people who believe in 9 religions. We have 22 official languages and 1,369 recognized dialects, and we are still one country. We have Aadhaar, the world's largest biometric ID system. 1.37 billion Aadhaar cards have been issued. We have the Statue of Unity, the world's tallest statue. We have launched satellites for 36 countries, including the United States. We have the ability to launch more than 100 satellites in a single mission. India is the 3rd largest economy in the world in terms of PPP and the 5th largest economy in terms of nominal GDP. Gandhiji had said, the future of India lies in its villages. What does this economic development mean for rural India? Under the Swachh Bharat mission, a toilet was built every 2 seconds. Electricity is now available in 99% of households. Under the Pradhan Mantri Jan Dhan Yojana, 478 million accounts have been opened. 3 new people join the internet every second, and 2 of them are from our villages. India has made remarkable progress in healthcare. Life expectancy has increased from 32 in 1947 to more than 70 years. We will produce more than 100,000 MBBS doctors every year, more than any other country. Ayushman Bharat Yojana is redefining healthcare delivery in India. Ayushman Bharat PMJ is the world's largest sponsored health assurance scheme that aims to cover 500 million citizens with a cover of $6,600 per annum per family. If a procedure is performed anywhere in the world, it's performed in India with excellent outcomes, be it a liver or a heart transplant or complicated robotic surgery. India is the world's third largest pharmaceutical manufacturer. 50% of the global demand for various vaccines, 40% of the generics demand in the US, and 20% of all medicines demand in the UK will be met by India. Our COVID vaccination program has administered 2.2 billion vaccines. On an average, 5 million Indians were vaccinated every day, which is close to the population of New Zealand. Through Vaccine Maitri, 242 million COVID vaccines were supplied to 101 countries. The Arogya Maitri project announced that the Global South Summit will provide medical supplies to any developing country hit by natural disasters. India is emerging as the preferred global destination for medical travel. Patients from 160 countries have received care in India. Our offering of yoga has been welcomed by the world. The resolution on the International Day for Yoga has been adopted by 177 nations. India is reaching out to the world. Our Honorable Prime Minister has visited 68 countries. The world is looking at India as a partner. 376 heads of state and government have visited India in recent years. With India's G20 presidency, the world shall realize the power of Vasudhaiva Kutumbakam. The world is one family. Indians can be found in all but 3 countries in the world, and wherever we go, we leave an indelible imprint. In the United States, Indian Americans have made a mark in business, science, medicine, and entertainment. Indians comprise only 2.5% of the British population, but 18% of all doctors are Indian. We may leave India, but India does not go out of us. We remain connected with our mother. We love our mother. We care for our mother. This is central to our sanskar, to our culture, to our heritage, and to our values. We do not just say we care, we actually do. And one way of showing we care is by sending money home for our mother's comfort. Although there are 8 million more Chinese outside China than there are Indians outside India, yet India sees the highest remittance in the world. Last year, more than $100 billion was sent back home. अपनी मिट्टी की महक में एक ताकत है, एक शक्ति है, एक कशिश है, वो आपको बुला रही है। कुछ समय भारत में बिताएं, और वो संभव नहीं तो कुछ समय भारत के विकास के बारे में सोचिए। No matter where one lives, everyone's heart beats for India. Everyone wants to contribute. Everyone wants to be a part of the transformation India is experiencing. We have now entered the Amrit Kaal of India's independence. In the coming years, a new India will unfold before the world, an India that will be TB-free, an India where there will be water for all, an India with a $5 trillion economy. Become a part of the India of our dreams, a new India. My brothers and sisters, India beckons you. The next time someone asks one of us if we are proud to be an Indian, let's say a resounding yes. And also throw in some data, because let's face it, where would the world be without Aryabhat's gift of the magical zero? I'm Anupam Sibal. I am proud to be an Indian. Jai Hind.
Thank you, Dr. Anupam, for such an inspiring video. I think it must have moved all of you, those coming from USA, API. So देश की मिट्टी मैं देख रही हूँ, कुछ मैडम के आंखों में तो आंसू आने लगे हैं. So thank you for that, and it's inspiring. So kindly stay back for cocktail and dinner, and we have wonderful singer from Indian Idol, Amit, who will be reaching soon to entertain you. Thank you so much for a wonderful evening.